3 media conferences later, Health Minister Nicholas Steele has not been able to divulge much information about the numbers reported or any other related information. The minister says what he can say is that the matter is still being looked at.
It's not about pointing fingers or so. It's about recognizing that we use every incident, no matter how unfortunate it is, as a way to improve, as a way to move forward, as a way to be better.
On Tuesday, government, through the Ministry of Health, signed a memorandum of understanding with Live Healthy Me to address the operations at the gynecology and obstetrics wards. Dr. Carol McIntosh, in addressing deficiencies within the system, says in the case of the report to the nation by the minister, certain information should not be divulged to the public.
That is not something that should be said here, because if you remember, medical care, confidentiality. I don't care how you say it. In the United States, we're fined if we just even say the person's name, let alone their diagnosis. Because if you can connect it to someone, you have now breached their confidentiality. So that is not something that should be discussed here, the cause of death. But what should be discussed is that we did have a loss. What are the concerns? We are offering to bring in a high-risk perinatologist to review the medical records across the board, not of the recent deaths, but of all the different losses, and helping the doctors and the nurses determine what may be the core remedies for this. How do we advance this? How do we improve upon this? Because the same thing happens in the United States. Exact same thing. Losses are not particular to any particular place. It is not a ranking of making sure that this whole system fails. No, it does not fail.
She says what's most critical is what is termed public perception of health services offered.
If you are feeling, oh my gosh, I don't know if I can make it into that hospital, because look at what they're talking about. You have the ministers and the media and all these people talking about this, when there is a mother that had a loss, and no one's talking about that. No one's asking, how did the mother feel? So why would I go into that health system? Because they're not dealing with this. They're dealing with that. So we're talking about the public perception. How do you help, not necessarily change it, but to recognize it and to hear it? Because we are basing it on patient-centered care. Every aspect, from the ministry to administration, to the doctors, to the nurses, to the person mopping the floor, are all equally sharing in patient care.
The one-year memorandum of understanding will also see a perception survey being carried out, the final draft of which will be presented to the Ministry of Health before year end. Eugenia Peters, GBN News.